Welcome back to San Antonio Living. Time for some girl talk. Today's topic of discussion is for the ladies who plan on having a family later in life and the test you can take to learn about your baby in your first trimester. Here's Alana with more.
Ladies, it's Tuesday. That means we have another topic to discuss from the Institute for Women's Health, and we're talking to Dr. Michael Troy. How are you?
I'm doing great.
Thank you for having me.
Well, thanks for
Okay, what are we
coming.
talking today?
Today we'd like to visit a little bit on advanced maternal age. Basically, that's defined by the American College of OBGYN as women who will be 35 years of age at the time of their delivery. And that incurs certain risk as far as especially chromosome issues with their babies.
Well, you know, whenever you wait later in life, there are potential risks, but that seems to be the new trend right now. Women are focusing on their career, focusing on something else now. They still want their family, but they're just going to do it later.
Right, and they do have an increased risk of infertility or difficulty getting pregnant. And we recommend if they try for 6 months and haven't achieved a spontaneous pregnancy, they should see their physician. They do have a higher risk of diabetes as well as hypertension disorders or high blood pressure issues in the pregnancy. But probably the biggest concern they have is, is their baby going to be affected by Down syndrome?
And what do you have for these ladies who might be concerned about this?
There's actually new first trimester screening that has not been available in the past. One is called the Ultra Screen. They basically measure the baby's neck. They do a blood test on the mom. They also calculate in the age of the mother, and they calculate out a new risk for Down syndrome based on that. It's read as a positive screen if their risk is still greater than a 35-year-old woman, and then it's read as a negative screen if their risk is less than a 35-year-old woman.
Now, how accurate are these screenings? That's important.
Sure it is. With the ultra screen, they'll pick up, as long as they measure the neck, the nasal bone, and the blood test that we talked about, they'll pick up about 95% of the babies that have Down syndrome will be picked up by this screen. There's also another first trimester screening test that initially came out. It was called cell-free DNA testing. And this was initially given to people at high risk, but now it's offered to all ladies that are pregnant. And they're able to pick up some of the baby's DNA inside the mother's bloodstream, and they can actually quantify it and see how much it is. If there's too much of the chromosome 21, then it'd be very reflective that the baby has Down syndrome. And this is about 99.9% ability to pick up a baby with Down syndrome. I think the important thing for patients to understand that these are tests that are available, they're not required, and it is just a personal decision that they'll make along with their physician.
Thank you so much, and thank you for informing our viewers.
Thanks for having me.
Okay. All right, ladies, if you want to learn more about the Institute for Women's Health, you can visit them on Topper Wine, Suite 309, or visit their other locations, or call them at 657-4099, or on the web, ifwh.org. Facebook, Institute for Women's Health.